COVID-19 now. Dr. Steve Threlkeld is the co-director of the Baptist Memorial Hospital-Memphis's Infectious Prevention Program. Let's take a listen now to hear what he had to say today when asked if people can catch the flu and COVID-19 at the same time.
It is certainly possible that there are some published reports of people having co-infection with coronavirus, the new coronavirus, and influenza. The first I saw of these were with rhinovirus, which is one of the most common causes of the common cold. And that gets complicated because they may have had a cold a week before and be getting better and then come down with coronavirus or COVID-19 illness separately. So that can be difficult to separate those. So we do test for other respiratory viruses lots of times before we do the coronavirus test. But that's where having an astute clinician involved in this workup and the testing is very important because you don't want to just take for granted that they have a rhinovirus, for example, and the flu for that matter, if they're having a lot of fever. The flu is more difficult because it's more similar to the COVID-19 clinically than are some of the other respiratory viruses. There are other ones. There's human metapneumovirus, there's respiratory syncytial virus that can be closer. They can have fever, they even have chest x-ray and CT scan of the chest findings that can be quite similar. Many of the respiratory viruses tend to be more mild. So it probably wouldn't throw you off the scent of COVID-19 if the person you're testing tested positive for rhinovirus, but they have 102 fever and they're short of breath and they have a lot of chest x-ray changes, because rhinovirus doesn't typically do that severe an illness. But some of the other ones, it can be more difficult, and we faced that issue several times when people tested positive for respiratory syncytial virus or influenza. You then go on and test them for COVID-19. And that really has to be something that the individual clinicians look at, and they have to use their acumen on when to